thank you for joining us for this first of a series of health webinars focused on providing you with relevant, real-time, science-backed updates on COVID-19. I'm Gail Hogan. I will be your moderator for this panel. We understand that you want information and you need answers to help you protect your business and your employees. That's the purpose of this webinar series, to give you the numbers, the data, the facts as we know them today to help in decision-making moving forward. A few details before we get started. All attendees, with the exception of our speakers, are muted. This session is being recorded and will be available on our website. Throughout the webinar, you may submit questions for our experts through the chat, and we will try to answer as many of those as possible. And if we can't get to your question here, we will provide you with an email to email your questions. So let's get started. Here with me are the experts from the Ohio State University Wexner Medical Center. Dr. Andy Thomas is Chief Clinical Officer and Senior Associate Vice President for Health Sciences at the Ohio State University Wexner Medical Center. Dr. Thomas has worked on the front lines of Wexner Medical Center's response and management of COVID-19, and he serves as an expert on providing best practice on a safe return to the workplace. Dr. Peter Moeller will be joining us shortly. He is Chief Scientific Officer and Vice Dean for Research at the Ohio State University Wexner Medical Center and College of Medicine. Dr. Moeller is directing COVID-19 based research for the Wexner Medical Center with more than 100 different research projects focused on COVID-19 across the medical center and health sciences. And we have Dr. Ian Gonsenhauser as Chief Quality and Patient Safety Officer. He provides leadership and oversight of quality and patient safety across the multiple units of the Wexner Medical Center. Dr. Gonsenhauser has led the efforts to provide safe and high quality care to patients amid COVID-19. Thank you all for joining me.
Thanks, Gail.
Great to be here, Gail.
Dr. Thomas and Dr. Gonsenhauer, will you please kick things off here by sharing the latest COVID-19 data and the trends that you are seeing?
Thanks, Gail. I'd be happy to take that. If someone could pull up the slides, that would be very helpful. What we'd like to share a little bit of background on today is really where we stand in the pandemic, both statewide as well as locally. And then we're going to be talking a little bit about some of our early learnings in terms of how to keep our own employees safe. Ian will cover that. And then Peter Moeller is going to talk about testing, different types of testing that can be done, and how that might fit into what you need to be thinking of as an employer. And then after we're done, well, hopefully just 10 to 15, 20 minutes of a little background, we're going to talk about some new offerings that we're going to have as a medical center that we hope to be able to help support local employers, community organizations moving forward with similar sessions like this. If you could flip to the next slide. One of the things I do feel is important for you all to be aware of is how you can track data of what's going on in your local community. I think, look briefly at the list of individuals who had signed up to be attendees today. I think most are from Central Ohio, but certainly this was broadcast broadly in terms of an invitation, so there may be some people from other parts of the state. What you're seeing online now is really the look at some of the ODH data that's available to the public. It's available each day after 2 p.m. As you can see, I've selected Franklin County in this screenshot. And what you can see in the top line are cases, then the middle hospitalizations, deaths, and then presumed recovered. As you look through this data, you'll see a gray bar to the right of cases, hospitalizations, and deaths. That's a period of time where the data may not be complete as of this time because of lags in testing, test results, especially tests at retail sites that can sometimes take 3 to 5 or even 7 days, we're hearing, to come back. That in that gray box, data will be added to each of those blue bars as that data gets to ODH. So, but if anything to the left of the gray bar, you can see as a trend, things are going in the right direction here locally. If you look at where that peak was, it's around July 4th. We certainly saw a pretty rapid escalation around that period of time, especially in cases in younger individuals. And if you remember, that's when the governor started with some new orders around either the color code of your county, which we'll talk about in a second, or now in the last 2 weeks, the entire state in terms of a face masking order. And we do feel like More individuals are paying attention to that here locally. As was discussed a little bit in some of the press conferences this week, there's a concern in some of the rural counties that has just not been as high of a priority for people, partly because there have been fewer cases in those counties. So they don't know anyone who's had it. They aren't thinking of it as a big problem, but yet now it's starting to take hold when you look at cases per 100,000, and that a large number of the top 10 counties in the state with high rates of cases are actually rural counties. But just as an employer, as you're looking at the data that's available, obviously we want to see those case numbers coming down. But the key message is that doesn't mean we're out of the woods, and we can stop all of these things to protect our employees, our customers, our communities. One of the problems with this virus is there's no natural immunity in our communities because it's a new novel virus. Unlike H1N1, which had some similarities to the swine flu from the 1970s, we saw some people even before there was a vaccine who most likely had either some immunity to it or at least didn't get as sick with it because they had a similar virus back in the 70s. With this, there's just not that option. So until there is a vaccine or until there's a medication that can reduce the transmission of the virus from one person to another, no county in the state is going to be able to say they're out of the woods. No one will really be in the green category, no matter how low their cases are, because they're one person away from driving to the next county, catching it, bringing it back to their school, their business, their nursing home, wherever it might be, and causing a problem or not breaking that county. In fact, today we were on the phone with some hospital leaders in a county in Southern Ohio where they have 3 different nursing homes, as well as some other businesses that have become hotspots just in the past week. And they were a county that had very few cases prior to that occurring. You can go to the next slide, please. This is another set of data that the Ohio Department of Health has on their website. This looks at those same metrics, but looks at a 21-day trend so that you can look on any given day for what's been reported the day before and see, was that a good day or a bad day? So on the right, you can see the 21-day trend splayed out over time, and you can see what the max has been in that 21-day period and then what the most recent day was. So once again, a chance for you as an employer to look, and this is statewide data, to look at where are we going as a trend in the state. Next slide. This is the color-coded slide that I mentioned earlier. This was designed about 2 months ago by the Ohio Department of Health. It's based on 7 different indicators. Some of those indicators are what we would call leading indicators, that they show the outbreak is getting worse. One of those is around the current state of the virus's impact on a county. That looks at the number of cases per 100,000 people over the past 2 weeks. That's what I would say is probably the most valuable indicator so far of what we have. And then there are some lagging indicators that include hospitalizations as well as bed capacity in the hospitals in that region of the state. So the way the system is designed, if a county only flags for a couple of the indicators as opposed to 6 or 7, the color changes over time. So yellow, orange, red, and then purple, and no county in the state yet has been purple. Which is terrific. Some have been on the precipice of going purple and have moved back from that. So when we look at both leading indicators and lagging indicators, you do get a sense that not any one indicator drives the color code, right? You can find problems in any one of these indicators based on certain scenarios, but when you look at 7 that would all be trending the same direction, you know things are getting worse. One of the indicators that they don't have yet at the county level, but we should have in the next 2 weeks, is the positivity rate by county, and that will be added to the 7 to make an 8th indicator. And then they hope to get up to as many as 10 indicators later in the fall once they have accurate data sources for the other 2. But this is updated every Thursday. It allows you to look whatever county your business is located in, or for some of you who have multiple locations around the state, you can see really where is the trend going in my county, and then drill down easily to each of the indicators to see what's going on in your area. Next slide. Just a little bit about where we are in the Central Ohio area. This is a quick depiction of the emergency management regions for the state based on hospital care. So the state is separated into 8 regions. There are 3 zones. So when you hear me talk about zone 2, I'm talking about zones 4, 7, and 8. So if you think about it from Columbus, anything that goes up 33 north or 23 north, up to say Upper Sandusky, north of Marion, out to Bell Fountain, down through Franklin County, the contiguous counties to Franklin County, and then anything 23 south, 33 south, or 70 east. That's all considered zone 2. There are over 40 hospitals in those 3 zones. And we have calls multiple times per week with hospital executives from each of those areas to keep track of what's going on in their local communities. We have public health folks on the phone. We have emergency response folks on the phone, so that we're keeping in touch on nearly a daily basis with what's going on in the area. And then there's data collection that happens on a daily basis that's reported out for our hospital capacity. Next slide. To give you a sense of where we are in the zone in terms of hospital capacity, this is just a quick chart to show you. Obviously, in the spring, back in April and May, we had a far worse scenario in terms of hospitalizations. You can see we peaked there in early May. The blue line are total patients in the hospital across those 40 hospitals in zone 2. And then as we were getting into the summer months, that data started to look better and came down. And for a long period of time in June, really right up until July 4th, we were sitting at a nadir of about 150 patients in the hospital across those 3 regions of the state. The red line are patients that are in the ICU, and the green line are patients that are on the ventilator. So they're, once again, hospitalizations, and certainly ICU hospitalizations tend to be a lagging indicator. We did have a bump up that started then right around July 4th that went till about the first week of August, and we're now starting to see the census come back down again, essentially corresponding to when the face masking order went in place across the red counties and then across the state as a whole. And we're glad to see that really the ICU hospitalizations haven't reached near where their peak was back in the spring, and neither have the ventilator cases. So that just gives you a bit of a snapshot of where we are both locally as well as regionally and statewide, and how you can track some of this data on an ongoing basis. Ian, you're up.
Yeah, thanks. We'll jump to the next slide. You know, we've learned a lot about the virus. As much as we don't know about it from the beginning of the pandemic, we've learned so much about what works and what precautions can actually create a safer environment and lead to these downtrends in the indicators that Dr. Thomas just covered. The biggest of those is obviously masking. That's the thing that we've learned has the greatest effect and the greatest impact on our environments, on our communities, and on community spread. But as we've learned that, you know, the thing about that that's become so obvious and so critical is the interventions are only as good as the application and the adherence. You can imagine for an organization like ours, where not only do we have healthcare patients and providers in our doors and in our walls every day, we have people coming to work knowing not only that they're at risk of potential exposure for COVID, but really knowing that we actually have COVID patients on the premises. Some of our employees may actually have to even be taking care of those patients. So for us, you know, it's been about not only identifying how masks can be utilized and utilized effectively, what it looks like to put that precaution in place, but also how do we turn that into policy that's palatable for our workforce and also allows them to feel that we truly are looking after their safety. I think for many of you, you're probably going through a lot of the same questions and a lot of the same battles that we fought all along to this point to figure out exactly what that looks like and what types of policies, procedures, and protocols are not only going to keep your workforce safe, but also allow them to feel safe, right? The fact that we are keeping them safe is only one part of the equation. The fact that they feel safe and recognize that those protocols and policies are not only fair and reasonable and feasible, but also going to be effective is hugely important. And so this is really, I think, one of the million-dollar questions for all of us right now. You know, how do we put these protocols in place in a way that everybody's going to recognize that you're looking out for their best interests, and we're not just trying to get people back to work for the bottom line interests of the organization, but in fact, really, really caring about them. So, you know, knowing how masks work, hugely important. We know that it's very important to have us masked up for personal protection, but that's only a small piece of the protection that's created through masks. Really, it's about keeping those masks on to provide protection across the broad environment, that in case you have anybody who may be an asymptomatic carrier, we've got the masks in place to prevent them from putting risk out in the environment and keep the whole workforce safe. So really, it's not just about the individual utilizing masks, but it's about the whole and having that 80 to 90 to 100% adherence across the whole workforce in that workplace environment to keep those staff members protected. So we've spent a tremendous amount of time on this, really, again, looking at how we can develop those policies in a way that everybody's going to feel that we're working towards their best interest and we're truly invested in their safety, but guaranteeing the safety not only of the workforce, but also the customers themselves. So this is a place that I think we've really explored pretty deeply what this means for the organization, what this means for the individuals, the staff members within the organization, and arrived at a place where we feel really confident in the protocols that are in place. And our workforce has expressed that we're doing the things that are necessary to keep them safe. I would evidence that with the fact that we are arguably one of the highest risk environments to potentially have spread within the workplace and have people potentially impacted by the work that they do and being potentially exposed to COVID. And we've truly not seen that happen. As a result of the protocols that we've had in place, the highest risk individuals that you can think of that could potentially be exposed to COVID at work have not had exposures that have translated into infections and further illness. We have truly seen a protected workforce in a way that I think speaks volumes to the policies and protocols that we have developed. And that's something that we're really eager to share with organizations across the state so everybody can have protocols that are going to feel truly effective in place.
Ian, can you talk a little bit about the messaging we've done with people about what they do in their personal life and how important that is, even compared to what they do at work?
Yeah, absolutely. You know, for an organization like ours, for organizations like yours, I think that the focus that we have is typically on how we reduce transmission in the workplace and how we create a safe workplace, safe environment. But so much of what people are doing at home is critical to assuring that. While we haven't seen spread within our walls here, within our hospitals, where we know spread does happen is out in the community, when people go home, when people go about their personal life outside of work. And it's so important to acknowledge that those risk factors can be brought into the workplace and can have a huge impact on the safety of the environment here. So we've done a huge amount of messaging on keeping contact circles small, on mask utilization outside of work, hand hygiene, limiting high-risk interactions, et cetera, as well as reporting and acknowledging when risk has been taken and when exposure has potentially happened so that we can do effective case investigation and contact tracing when somebody's had a high-risk exposure. Probably the biggest benefit of that type of work has been identifying those true high-risk exposures versus what feel high risk or the anecdotal exposures that don't actually require many of the interventions that a high-risk exposure does in fact require. Typically, people have a sense that their exposure is of higher risk than it really was. And when we tease into it and when we delve into what that exposure really looks like, we find that people don't actually need to have necessarily the quarantines or the 14-day, pull out of work. Some of those things that feel necessary immediately and really do cut into your ability to have a whole and effective workforce. So in doing that work, we found that far fewer of the exposures have translated into people missing time, missing work, and needing to go into investigating their families and others for contact exposure. It's been a hugely beneficial element of what we've done. And as we've learned more, we've seen fewer and fewer people needing required time off than was initially considered.
Yeah, I think the other thing, Ian, if you could talk about the idea of contacts. I had a call yesterday from one of my patients who's a local executive who, an administrative assistant in their firm had tested positive. And my patient was getting in touch with me to say, one, I need to get tested today. And two, what do I need to do with quarantine? And in reality, when I talked it through with her, she had been in passing around the individual that tested positive a couple of times, like literally walking past their desk or something. And then she said, well, but I was with the people that were with her. Can you talk a little bit about how that works?
Yeah, so important to understand the degrees of separation from a true exposure and when that really translates into, needs for evaluation or testing for an individual. There's a sense that as Dr. Thomas said, if you came in contact with somebody who came in contact with somebody who was a positive COVID test, so now you're at risk or exposed or need testing. There's a lot of mythology around that. And one of the things that we've done, I think, so effectively is really try and cut through the mythology and get to the reality. And that is that an exposure really takes direct, close contact, actually over a fairly prolonged period of time with no mask in place. So effective mask policies are going to drastically limit the number of true exposures that you have and true exposures to contacts. So a lot of cutting through the anecdotes and cutting through some of the stories that are out there, the fables that may exist, can allow you, again, to really streamline and reduce the number of employees that you're actually going to have to pull and test and put through contact tracing. So we spend a lot of our time kind of talking people off the ledge and helping them understand that the exposure that they think they may have had actually isn't a true exposure and doesn't really warrant the investigation that a true exposure would. Really important point.
Gail, it looks like Peter's joined us now.
Yeah. Yes, he has. Hi, Dr. Moeller. And you joined us just in time because I wanted to address this next question to you because it's regarding testing. And a lot of people have talked about this since Governor DeWine's false positive last week. And, you have the yin and the yang of it wasn't and it was and it wasn't. So give us an update on testing. Where are we with that?
Yeah, really good question. A lot of questions this week about testing, and we've learned probably more than we'll all ever want to know in our lifetimes about COVID testing. So I think, the bottom line today is we're all on the same page that we need to do more testing. And that testing ranges from everything from the very fancy high-powered telescope that we've heard a lot about with the RT-PCR testing, all the way down to point-of-care tests that range from everything from the Abbott point-of-care test that we commonly use in our emergency department, or some of the tests that we've heard about that are called the antigen tests. All test in a little bit different way. And I think all three of us on the call would agree they're all very important. They're all very important because they serve different roles in our testing toolbox. And, we continue to want to make sure that the science really is following policy, and that when we are providing test data to people across the state of Ohio, whether it's people that are symptomatic or people that are asymptomatic, that the test really is doing what we think it is. It's probably fair to say, and I know I would speak for my two colleagues on the phone, that no test is 100%, but we do want to make sure, though, that when we let someone know what their answer is, that there's good science to back it up. And I think that's what we saw last week, is that we had a newer technology, which is this antigen test, which looks for a little tiny piece of protein on the surface of the virus. It's new, so there's a lot more work that needs to be done on it. That we went back and had a provisional positive that we then tested by the gold standard and found that in this case it was a mistake and we fixed it. So I think that's the thing that we need to continue to push on, is that science doesn't stop, that when we have tests that we continue to make them better, that we develop new testing modalities, and that at the start they may not be perfect, but using high-powered telescopes for all of our testing is probably not going to get us there. One exciting thing that we're working on at Ohio State right now is this concept of pooled testing, which is the idea that you can take one test and give it to maybe 5 or 6 or even 10 asymptomatic individuals. A couple of advantages. One is it majorly decreases the amount of reagent or equipment that you need to do these testing. We've heard a lot about that in the news today. The other thing that really does is it decreases the turnaround time, the time that it takes by the time the sample gets to the lab to the time that a sample is reported. And that is so important because, as my two colleagues have probably mentioned over the last few minutes, to be able to isolate people and keep them away from infecting others is going to be absolutely critical for the next few months.
And as you have mentioned to me before, Dr. Moeller, things keep changing. I think that is very difficult sometimes for people to understand. They're not sure what to believe. They're not sure what they should do. Can you just give some advice to folks when it comes in regards to feeling that they're not quite sure where they should go with this.
Right. So I think, I think the answer to that is sort of twofold. The first is Ohioans should really take great comfort in the fact that to date, over 90% of the testing that's been done across the state has been done with the gold standard high-powered telescope COVID RT-PCR test. The second thing is, as a medical center, and we're very aligned across other medical centers and hospitals across the state, that when we do bring in a new technology, and whether it's a point of care test like the Abbott test, which we're using and using widely, or a new test like the antigen test, that we spend a lot of time really understanding its strengths and also its weaknesses. That just because something might have some weaknesses doesn't mean that we don't use it, but we need to understand that when we give a result, that we do it in a way that maybe you need to have a second opinion, or you need to have a second confirmatory test. And so again, the 1.6 or 1.7 million tests across Ohio have really been the gold standard. As we bring on a new technology like the antigen test, we spend a lot of time in the lab making sure that it's tried and true before we would deploy it across a population. And then I think, how do we turn for answers? It's these sorts of webinars and having conversations with people like Andy or Ian or myself on how do you protect your business, or how do you think about going forward? I heard this on the news. Is this something that I should take seriously? And, I know all three of us are happy to have those conversations.
We do have a couple questions, and I'd like to get to them quickly. This one has to do with N95 masks that the person uses on rare occasions that they go out in public, mostly shopping to the grocery store. They've been reusing it in increments of 30 minutes. They're not a medical professional, so they don't have easy access, and they're wondering, can they use it, and what are the risks of reusing it?
Well, I'd step back to challenge the assumption of the question first before answering it. One is, you actually don't need an N95 mask in this situation. This is a disease that's mainly droplet based, and a regular mask that would be used for isolation or in surgery is sufficient. In fact, our staff who take care of COVID positive patients, that's what they wear, unless they are going to be doing a procedure that's called aerosol generating. So putting a tube down someone's throat, which makes the person cough up large amounts potentially of the virus. So intubating them, doing a scope from above, or doing a surgery that disrupts, would be a good word, disrupts the mucosa in their upper airway or in their lungs. So an N95 for the average person going out to the grocery store is really not necessary. I don't wear one. I know Peter and Ian don't wear one when we go to the grocery store. To be honest, when I'm in the hospital, I don't wear one. The only time I wear an N95 or an N100 mask is when I'm swabbing someone because they then can cough right in my face, and that's an aerosol generating procedure. Or if I'm going to visit one of my patients in the ICU and they're on a sort of breathing treatment that then can make it a higher risk, it's called CPAP, it can make it a higher risk to have those aerosols in the air. But a regular isolation mask, and most cloth masks are fine. We do, if you come to the hospital, hand you a medical grade mask. Only because we want to make sure, since you're in our environment, that you have a mask that is sufficient. But most of the cloth masks that are on the market are sufficient. Because if you think about what, as Ian was describing, what the mask is about is source control. It's about you potentially being an asymptomatic positive, not knowing it, and you spreading that out of your own mouth. The mask does also protect you if someone else either isn't wearing a mask or not wearing it appropriately. And there is some amount of the virus droplets in the air. It does protect you from getting it in your mouth and nose. But if you think about it, surgeons have been wearing masks in the operating room for over 100 years. They don't do that to protect themselves from whatever's going on with the patient. They do that to protect the wound or the patient from getting bacteria out of the surgeon or nurse or anesthesiologist out of their mouth into the wound of the patient. It's the exact same concept. I don't think any of us would ever say that they would want their surgeon to do their surgery not wearing a mask. It's kind of the same thing when you're out in public. But a regular surgical mask for that purpose of source control is sufficient.
Okay, Dr. Thomas, we have one more time for a question, and this is regarding the time of being close contact and what that means. Apparently there's a definition that says close contact getting COVID-19 is less than 6 feet for 15 minutes, but they don't know if that includes cumulative time, if that means masked or not masked. So I'm not sure who's best to answer this, but I know that is a question of people saying, really, what does cumulative and time mean?
Ian, you want to take that one?
Yeah, absolutely. So this is a great question, and there is a lot of kind of leeway in the answer to this, if you will. These really, the definition is correct. It's within 6 feet. It's for 15 minutes or greater. That's considered a real exposure or a higher risk exposure. In the definition from the CDC, the use of masks and cumulative or non-cumulative time does not go into the definition. We take those exposures on a case-by-case basis, and we really look at the environment, the interaction, what was happening during that interaction, and whether or not masks were being used. And we use all of that information to really qualify the nature of that exposure. So, if you're just sticking by the CDC definition, that's going to be one of your most conservative measures, and it's going to lead to far more kind of real exposures that you identify, versus when you start teasing that interaction apart a little bit and trying to identify, was this indoors, was this outdoors, what was happening, was it just a conversation versus a physical exam or an aerosol generating procedure or something of that nature, and then also were masks used or not used. All of those variables are, for us, going to lead to a determination of high risk, moderate risk, or low risk for that interaction. That's really the kind of thing that requires a little bit of training and a little bit of guidance to be able to tease those details out. We utilize experts to do that through our infection preventionists and our clinical epidemiologists, and they have trained many of the people that do the investigations for us. Now, the investigation itself, doing that case investigation, it doesn't require a medical degree. It doesn't require special certification as an infection preventionist, but it does require a little bit of guidance and training. And so what we've done is we've trained people with basic bachelor's degrees and others to do those investigations and to come up with those analyses of exposure and rate the risk of exposure and use that to then drive our response. That's the kind of thing that we'll talk about in a little bit in terms of having a designated safety officer within your organization. Those are exactly the types of things that we can help train staff members or leaders within your organization to do, and hopefully have significant gains, again, as far as the number of people that may have to be traced, investigated, or potentially even have time off work.
Well, thank you, Dr. Gonsenhauser, for leading me to the next part of what we're going to discuss, and that is how the Ohio State Wexner Medical Center can help you, the folks that are on this webinar today. Ohio State not only is able to access the latest data, but also have experts like Dr. Thomas, Dr. Moeller, to interpret best practices, safety. It's a tremendous resource to have in our community during this pandemic. So Dr. Thomas, how can OSU help?
Well, Gail, your description is good. And this is what we really want to talk about for the rest of our time beyond taking some additional questions, is how we can help you. As Ian said, we are not only an educational institution, we're a healthcare institution, we're a very large employer, we're also a landlord. As Dr. Moeller knows, we have students moving into dorms this week. So we think about this issue really in a broad way. And what we have done both on kind of individual one-on-one phone calls is had a lot of discussions with employers. I think if I look at the attendees today, we have almost 90 people on the line based on the session advertisement that was sent out. What we would like to do is work to build an ongoing relationship with any company that needs our help. And we think that relationship could have multiple tiers. And we're going to talk about that in a second and what we think the range of elements of that relationship might look like. I'll cover the first couple. One is really a goal of having educational sessions like this on a routine basis. Obviously, today's is free and open to anyone who came. What we'd like to do is schedule these on a routine basis. It could be weekly, it could be every other week, with large group sessions, could be 100 or more people on, where we can go through the basics of where we are, what have we learned this past 2 weeks, what are we seeing as trends, et cetera, and cover that really with a large group of corporations and executives at a really high level with a small group of a panel of us educating a large group of individuals. We think that's kind of the first option. The second option would be what Ian was just describing, which is training a safety officer. So who either per location or for your entire company would be the person who's charged with making this work. So we would do both training as well as ongoing maintenance. We would be available to answer questions from those people during those sessions. And it would be really kind of a train the trainer approach, where we would be able to help your folks do the bulk of the work on site locally in your company, whether it's education, training, planning, whatever it might be. We'd be available to answer questions in these sessions. But it would really be for us to have a focus group of experts from the companies working with our panel of leaders on once again, it could be weekly, could be every other week, depending on the pace of this, it could be less often. But we're thinking probably every other week to start after an initial training. I don't know, Ian, you want to cover the more consultative aspects of it?
Yeah, absolutely. So, you can imagine a variety of scenarios in your organization that lead to questions down the line, sort of where do you go next? And one may be, we don't believe that we have very high risk environment. And so we think that this is going to be few and far between that we're going to have an issue that we have a question about. In that case, it may be to your advantage just to have some of our experts standing by and ready to field a phone call from you, answer questions that you may have. We think this may have been a high risk exposure, but we're not really sure. Can we run it by you? And you can give us your take and kind of help us decide what next steps are. Something as simple as a lifeline like that, I think can be a tremendous safety measure and can just be a huge comfort for the organization to know that you have somebody standing by and ready to help work through an issue with you. The same may be true if you've actually gone ahead and you've had somebody trained as a safety officer. As we know all too well, every one of these interactions, every one of these cases is a standalone case. It's a case in and of itself, and there are details and nuances that you really are addressing new and fresh every time a case comes through. So even if you have a trained safety officer, while we'll be able to train you to handle almost every situation that you may encounter, there are still going to inevitably be questions about some nuance. Well, it was not cumulative 15 minutes or it wasn't 15 minutes all at once, but it was cumulative over 3 different close encounters. What do I do then? Or they had masks on most of the time, but for 2 minutes of an interaction, the mask was off. Now what do I do? Those unique and novel situations are going to present themselves. So another time that just picking up the phone and having that kind of phone a friend, to go back to the Who Wants to Be a Millionaire days, could be really, really valuable. Also on-site consultation and potentially actually looking at your environment, walking through your environment with you, looking at policies and protocols, kind of working with you on site in real time in your environment to identify what high risk factors may be, looking at the nature of interactions between staff members. All of that could be potentially useful or potentially necessary as well. Again, depending on what the nature of your business is, what the nature of your employee interactions may be. So the on-site consultation is kind of maybe one of the most intensive levels, and that would be us bringing many of the same people that developed our policies and protocols, looked at our risk assessment internally, bringing them to your organization, walking through your site, walking through your areas, and coming up with what some of your strategy may look like. I think that's something that would have more of the view of a traditional consultative type of an exercise that you're probably all familiar with. But again, very hands-on, very high resolution, and the ability to really tease apart the variety of risks that may be associated with your workplace or your environment, and come up with solutions, again, that not only are going to keep your staff and your workforce safe, but also going to help them feel safe and know that you're really committed to that safety. Really critically important for them to come back and be able to get to work.
Thank you. Now, Dr. Moeller, I know you have a few more offerings from Ohio State.
Yeah, I think a lot of it gets to a lot of questions that both Ian and Andy and I get a lot, and whether it's around spacing or masks. We talked a little bit about testing earlier, and a lot of questions about, if I have this, my organization is this size, or we have this many plants, or we have this many different teams working together. I guess to Ian's point is to really spend some time developing, similar like you would do with a PPE plan or a distancing plan, a testing plan. And, a testing plan, it may be that you don't need one. It may mean that you really focus on what happens if you get someone that's symptomatic, right? Which is something that Dr. Thomas really continues to preach, is that we can test as many asymptomatic people as you want, but really it's what happens when someone shows up with a fever and a cough, right? So where are people most together? Where do we see the most congregate areas of your workforce? Are there people that are on a floor where there's manufacturing where maybe you can't distance and you want to do some background surveillance testing? A lot of questions of what's an antibody test and how is that different from an antigen test? And all these tests are super confusing. And it's, we spend a lot of time and are happy to have conversations about, should you test? If you test, how should you test? And, what's the numbers? Everybody also has budget. So it's important to understand, what's the cost of doing these sorts of things. So, happy to continue to have those conversations as well.
Dr. Moeller, before I let you go, I do have to ask about vaccines, because so much of this will depend on where we go in the future once we get a vaccine. So where are we?
Well, things are moving along, I think, much faster than I know my colleagues on the phone would have anticipated. We have diseases out there that are very similar right now that we've been working on vaccines for decades, and there's no answer. We were very fortunate early on that industry got very involved in not just everybody trying to do the same thing, but really 10 very good approaches for vaccine development. We're now starting to move into the phase of testing for many of them that now gets into tens of thousands of people being tested. We're very fortunate at Ohio State to be involved in at least a couple of these different major vaccine trials. And it's going to be very good because we're going to be able to see what's the impact of these vaccines, not in England or not in San Diego, but really how do these vaccines impact the people in the state of Ohio, and in fact in central Ohio. So one of the nice things about being part of these weekly or how often we do them large meetings is to understand kind of what is cutting edge, what is the tip of the spear, and what can you do as a business owner, or what can you do in your business to maybe even get some of your employees involved in some of these studies. So it's a very, very exciting time for science. It's a very unsure time right now in the world, but we are starting to see some advances that look very, very exciting. I think all three of us are optimistic. We're cautiously optimistic, but things are looking pretty good so far.
Thank you, Dr. Moeller. And I do have another question, and this is interesting because it goes further than the physical aspect of COVID-19 to the mental health aspect. And as this person says, feelings of isolation and being disconnected are creating other health issues. Aside from using our own employee assistance program, what can employers do to try to mitigate these issues? And does Ohio State offer similar programs?
We certainly offer programs to our own staff. We have a program here called the Stress, Trauma, and Resilience Program that is used in a variety of settings. We've even used it when we've moved from one building to another because that's a stressful time. But certainly in this setting, we've used it a lot with our staff. I can tell you, I've having these discussions with my children's school. I've done some webinars like this for the faculty and staff at the school. I think it really falls back on the community and the culture that you have going into the virus is probably one of the most important keys. If you have a really difficult culture where people don't support each other and get along, that's only going to be exacerbated by this situation. Much like we see that oftentimes the people that get the sickest from the virus were people who already were sick when they became infected with the virus. It's the same thing. A corporate culture that isn't strong and supportive up front is going to have a more difficult time with this. But I think recognizing that there is need for socialization for people. So not having every Zoom meeting that you're having with your company be a meeting, but have it be a happy hour that everyone can still get together. Having ways that groups of people that, if you're not seeing people that work for you, set up that extra 15 minutes to check in with them. Say hello, having supervisors and managers make sure, they look like they're being real productive, so I'm just not going to bother them. That's probably not the right way to go. I know we've had some staff meetings just with the 10 or so direct reports that I have, and you realize I haven't seen them physically in person now. It's going on 5 months. And I think especially companies that have a lot of turnover, how you think about how you onboard new people into this environment is another thing to spend a little bit of extra time on. I don't know, Ian, if you have any other thoughts on that.
Yeah, no, absolutely. I mean, to that point, you know, when you think about organizations and what we are as an organization, some would maybe think initially that we're a Swiss Army knife. You know, we've got a tool for everything. But I think a Swiss Army knife, you've got a lot of general tools that aren't necessarily the right tool when you need it. We're sort of more like a whole mechanics shop, right? We've got exactly the right tools for really whatever situations in this pandemic may present themselves. Our experts in psychiatry, psychology, stress, trauma, and resiliency management have been instrumental in developing how we've approached this and how we've approached employee and staff wellness. And if we hear from an organization that that's a major need for you, that you have a need for that expertise to come in and help with managing and mitigating some of those circumstances, we certainly have the experts that we can pull into that and help craft strategies for your organization as well.
And I know it's not just organizations, and obviously we have employers on this, but it's for everyone, as you said, Dr. Thomas. In your own home, we have to take into consider of how we treat each other. I'd like to thank you all, and I'm going to wrap up this webinar by posing a live poll question for all of you who are on this webinar with us today. Given what you've learned about the ways Ohio State can support organizations during COVID-19, please let us know which service offerings below you feel your organization would benefit from or be interested in exploring further. Select all that apply. General COVID-19 education, train the trainer program, phone consultations, on-site consultations, testing and contact tracing support, and comprehensive strategic partnership. I'll give you a few moments to fill out the survey. We'd like to thank you for participating in our poll, and that is going to help guide us on how we better serve you and your unique needs.
Gail?
Yes.
I'm going to share my screen quickly just to make folks aware of some resources that are on our website. Are you seeing the Return to Work website?
I am.
Wonderful. So if you type in Ohio State University Wexner Medical Center or just Wexner Medical Center COVID-19 Return to Work, we can also send this out to all the folks who registered for today's webinar. You'll see there are a variety of resources we put together for both employers, employees, a little bit about testing. There's an entire section here around mental health and coping tips that really help. We're obviously healthcare professionals and an employer. I know many of you are not healthcare professionals, but to help think through what the impact of stress and staying healthy might have, and some tips for how you might implement some of these in your corporate environment. Also, even down towards the bottom of the site are issues around tips for students. Many of you may have children or grandchildren. So how this might also help with your family. So I just want to make sure people were aware that those resources are out and on our website now. But obviously, as the programming we talked about for the last few minutes gets off the ground, we'll be covering those issues in much more detail with similar panels to what you've seen today with other experts from across the medical center on the finer points of a lot of those issues.
That's great information. Thanks for pointing it out, Dr. Thomas. And I'd like to thank you, Dr. Thomas, Dr. Moeller, and Dr. Gonsenhauer for your time this afternoon and sharing your expertise with folks on this webinar. And I want to thank all of you for joining us this afternoon. We hope that you will join us for future webinars in this series for the very latest on protecting your business and employees during COVID-19. Again, now, if you would like to connect with our team to further explore partnership opportunities, please use this email, covid19consulting@osumc.edu. COVID-19consulting, there it is on the screen, @osumc.edu. There you have it. We appreciate you joining us. Thank you. Be safe and be well.